Hey there, VCE HHD students. My name's Andy. I'm a VCE Health and Human Development teacher. In this short video, we're going to look at the Ottawa Charter for health promotion, including the action areas of the Ottawa Charter, which you might know as bad cats smell dead rats. This is relevant to Unit 3 Area Study 2 for the 2025 plus HHD study design. There's lots of different ways to engage with the Health Resources Hub if you're not already. If you're on YouTube at the moment, you can subscribe with the button in the bottom corner of the video there, and that means you'll get alerts to all of our new videos coming out across the year on our YouTube channel. Also got our website, the hrh.net.au, where there's opportunities for students and teachers, and that's being updated regularly, so please go and check that out. We've got our Instagram, TikTok, and Facebook pages where you can follow us and get alerts to our new videos and other opportunities, and also our email, info@thehrh.net.au, if you'd like to get in touch. So what parts of the course does this video relate to? So we have done a number of videos already on the first key knowledge point of Unit 3 Area Study 2. But as you can see there, what we're focusing on now is the last dash point of that first key knowledge point, which is looking at the concept of the social model of health and the Ottawa Charter for health promotion. Now, I think this is one of the most important parts of Unit 3 Area Study 2, because as you can see underneath there is three key skills that link into the action areas of the Ottawa Charter, and we'll be looking at those in a moment. And so what that means is that there's lots of different types of questions that might pop up in your SAC and the end of your exam that could be linked into, okay, these action areas. And so I think you need to know this part of the course really, really well, inside out and back to front, because as I said, there's lots of chances that questions will come up related to this. And so if you don't know it well, then there's obviously the chance that you won't do well in those questions. So by knowing these action areas really well, you'll be able to practice applying them to a range of different scenarios. And then hopefully if the similar scenario pops up in your SAC and then in your exam, you'll do well in those questions. As you can see, the different parts of the course you might have to link this to are the social model of health, okay, as well as case studies, data, and examples that relate to health promotion programs, and also analyze initiatives introduced to improve Aboriginal and Torres Strait Islander people's health and well-being in Australia, and how they might also reflect the action areas of the Ottawa Charter for health promotion. So lots of different parts of Unit 3 Area Study 2. So what is the Ottawa Charter for Health Promotion? As you can see here, it mentions that it's an international agreement, so a charter is like a document that was created by the World Health Organization in 1986 during a health promotion conference held in Ottawa, Canada, so hence the name, the Ottawa Charter. And so essentially this document provides a framework for creating health policies and actions that improve population health and well-being. So it was a document that different governments and organizations, okay, signed on to and agreed, that they would try to incorporate when they were trying to develop policies and programs, etc., that were designed to improve population health and encourage people to engage in healthy behaviors. And so as part of that document, it considers health promotion the process of empowering people to increase control over and to improve their health. So that's definitely a description that I'd make sure you have in your glossary terms for that term, health promotion. And so essentially as part of this document, there is these 5 action areas of the Ottawa Charter. And so these 5 action areas help to guide, okay, governments and organizations when they're implementing these policies and programs, and give them a sense of some of the things that they should be trying to incorporate into those programs to try to ensure that they're encouraging people to engage in healthy behaviors that will help to promote their health. So you can see there are 5 names of those action areas: build healthy public policy, create supportive environments, strengthen community actions, develop personal skills, and reorient health services. And we'll look at what each of those mean in a moment. But as you can see down the bottom there, bad cats smell dead rats is a mnemonic that's sometimes used, okay, by teachers and students to help remember these action areas. And so the first letter of that mnemonic, so the B for bad, obviously links into the B for build healthy public policy. And so the first letter of each of those different words links into the first letter of the 5 action areas. So hopefully that might be useful to help you also remember these action areas of the Ottawa Charter. So what you can see here is a short description for each of these action areas, and definitely I would make sure that you're incorporating into your own, okay, notes, a description, as well as the names of each of these action areas. You essentially need to know the names of them word perfect, because often they're asked for in SACs at the end of your exam as part of a question, firstly to identify an action area, but then you might be asked to describe them. So you can see that build healthy public policy relates to laws and policies that are designed to improve health-related behaviors. So some examples of things that might be linked into build healthy public policy could be things like seatbelt laws, so encouraging people obviously to be safe on the roads, or it could be related to smoking laws and policies that mean that individuals aren't able to smoke indoors, etc. So any kind of law or policy that's part of an organization that tries to encourage people to act in a healthy way to promote their health can be linked into this particular action area. Create supportive environments. So that has a focus on the socio-cultural and physical environment and how that can be adjusted or changed to improve health behaviors. And so an example to help you think about this might be when new suburbs are being built, okay, on the outer fringes of a city, they might be trying to incorporate more bike lanes and parks into those areas and those suburbs. And so that's ensuring that the physical environment provides opportunities for people to be physically active, okay, by obviously cycling or going to parks and being physically active. Also, there it mentions the socio-cultural environment. So that could be where local councils might be providing opportunities through groups such as mothers groups for, in that example, mothers to get together and to discuss things that are related to pregnancy or provide support to mothers as they're embarking on a life with a newborn. So things that are in the socio-cultural environment as well. So things like groups, okay, and programs and opportunities, okay, can also be considered part of create supportive environments. Strengthen community actions. The next one there is looking at a focus on community groups and individuals working together to promote health and well-being. So once again, a good example of this can be local councils that might be engaging with people in their local community, okay, to engage in campaigns or programs, okay, that might be designed to improve health and well-being. So a local council might be running, say, a drug and alcohol session where they might get some community members to speak about their experiences and how to reduce the risk of engaging with things like alcohol and drug taking. And so trying to provide examples, if you're linking into this particular action area where there's community and individuals working together, then that can be linked into that action area. Next one is develop personal skills. And so this is one that I would always encourage my students to look for first if they're trying to link this into a program or a campaign, because it's got to do with education and skill building to empower people to encourage healthy behaviors or act in a healthy way. And so nearly all programs and campaigns have some kind of education or skill building element. So whether it's trying to improve the skills people have, okay, so that they're able to be more physically active or improve their nutritional intake or reduce the likelihood of doing things like smoking, okay, that can all be linked into develop personal skills. So nearly all programs are trying to educate people, build their skills so they can take more control over their health to improve healthy behaviors. And then the last one, reorient health services. So that has a focus, as it mentions there, on health services. So that might be things like GPs or allied health professionals or hospitals, and focusing more on education and prevention of health rather than just diagnosis and treatment. So an example might be if you're to go and visit a GP because you had a condition such as type 2 diabetes, instead of just focusing on diagnosis and treatment, the GP might spend some time with the patient, okay, educating them on some changes they could maybe make to their lifestyle to try to reduce the impact, okay, of type 2 diabetes, such as improving their nutrition and physical activity levels. So in particular, remember, it's related to health services. So as I said, what you're most likely going to be asked to do with these is to remember their names, to describe them, and then apply them to programs or campaigns, or link them into specific health conditions. Now, if you're wanting some opportunities to do that, you can see down the bottom of the slide there, we've got a free student newsletter. So I'll be sending it out, okay, as part of this free student newsletter in the coming weeks, some opportunities, so some case studies and scenarios for students to practice applying these action areas. And so if you'd like to sign up to that, you can head to our website, thehoh.net.au, where there is a link to sign up to that free student newsletter. So let's have a look at a past exam question related to the action areas so you can get a sense of how you might be asked to apply these. So you can see this one here is a Headspace campaign, the Take a Step campaign, empowering Aboriginal and Torres Strait Islander young people to manage their mental health. So there's some information there about the campaign, but if we skip down to the question underneath, it was asking you to identify and describe 2 action areas of the Ottawa Charter for Health Promotion that are reflected in the Take a Step campaign and explain how they're evident. Now, it was worth 6 marks, so quite a number of marks. And you can see there, the question is asking you to do identify and describe. So that means you'd have to like name an action area and then have a short description of it and then link that into the case study there. And so you have to do that twice for 6 marks, so 3 marks each. Now, for this example here, a good example would be develop personal skills. And as I mentioned earlier, that's often evident in these kinds of campaigns and programs. And if you have a look through this one here, it's talking about how Aboriginal and Torres Strait Islander people through the campaign are provided with small practical steps towards feeling better and how to manage their mental health. So you could link that into develop personal skills and providing education and upskilling Aboriginal and Torres Strait Islander young people and how they can manage their mental health better. Also for this one here, you can talk about create supportive environments. It talks about how culture, identity, place, and spirituality, okay, is considered as part of this campaign to ensure the campaign is culturally relevant, and that's part of a supportive environment to engage Aboriginal and Torres Strait Islander people in a campaign such as this. So there are different types of, I guess, action areas that are more evident in different programs, and that's why it's really important, I guess, to practice as many different scenarios and questions as you can so that you can practice linking in all 5 of the action areas in different ways. So make sure you seek out, okay, different programs and questions to practice linking all 5 in. It's no good just to remember a couple of them and be able to apply a couple, because you could be asked in a question to link in a specific action area. So if you haven't practiced that, then you might not be able to do it. Another way of getting some different practice questions, if you're after some for these action areas, is to grab a copy of this revisions questions book that I've worked on with ACE for the new course this year. So it's got over 500 marks worth of practice questions and lots of chances for you to apply those action areas if that's something you're wanting to do. It's also got a full chapter on extended response questions, and so that's relevant for the new section B in the end of year exam. And so it's also got a full trial exam as well. So you can head to book.acevc.com and order a copy of that, and it'll come now post. Also got our website there, the hrh.net.au, and as I mentioned earlier, there's opportunities for students and teachers there, so please check that out. Thanks very much.